Well, there is a special place in hell for the person who attacks a children's hospital and disrupts medical care for thousands of innocent children. That is the message from Debora Land, the mother of a teen who is a patient at Lurie Children's Hospital in Chicago, which has been hindered this last couple of weeks by a cyber attack from a, quote, known criminal threat actor. This attack has forced the hospital to shut down its vital systems for phone, email, medical records, and it has caused a multitude of issues, including parents trying to communicate with their kids' doctors and get appointments and prescriptions. Debora joins us now with the latest on this ongoing frustration. I've been thinking about you all for the last couple of weeks and the challenges that you're facing. We'll get to that in a second, but tell me about your daughter, how old she is, and what are her health challenges right now, Debora?
My daughter is 18 years old. She's been a patient at Lurie Children's Hospital since she was 2. She has a number of medical issues that require us to see at any given time 4 to 6 departments at Lurie. For her privacy, I'm not going to go into the details of what that is specifically, but we are frequently involved with the hospital, have lots of ongoing projects, programs with various providers, and this happened to be a very busy time for us with Lurie when all of this outage started.
So what is the contact right now with the hospital? What information are you getting?
Contact with the hospital is somewhat limited. It's difficult to reach out to your providers directly. The hospital is really trying to channel everything through what they're calling their call center, which is available Mondays through Saturdays. The challenge of the call center is that it can take days to get a return call. I called the first time the first Sunday that the call center opened, and I called again on Tuesday, and it wasn't until Thursday morning that I heard from the department I had been trying to reach.
So what type of burden, Debora, is this putting on you and your daughter and your family, the stress that comes with this type of attack?
The challenge for us has been that some of our appointments are flexible and some of our appointments are absolutely inflexible. We have an appointment coming up at the end of this week that we booked 6 months ago. And so in order to be prepared for that appointment, we needed blood work. But what I learned through conversations with various people is that if you don't have a paper order from your doctor, you can't get blood work at Lurie because anything that was entered in the computer system before the outage is inaccessible to them. So that has been something that has required a lot of time, a lot of persistence. And I don't know how parents who work full time can manage that.
Right. So what options do you have? Can you go somewhere else to get blood work? Are they working with other hospitals and medical organizations in this interim period?
At this point, Lurie's lab is still open, and through the call center, after 2 calls in 5 days, we were able to get the paper order that we needed. So that part of this has been resolved. We're very fortunate that none of my child's medical issues are what I would call immediately life-threatening, and we didn't have any surgical procedures scheduled during this outage. But when you have to book an appointment 6 months in advance, you can't easily reschedule.
Yeah, no, I know that. And that's even for a non-emergent situation, right? Just a general appointment. A special place in hell for the person who would do this. Attack a children's hospital were your words. I couldn't agree with you more. This is a known criminal actor looking to get paid. We've seen it happen at other hospital organizations. What would you say to the people who are behind this?
That the amount of damage they're doing to patient families is horrendous, and that I stick by my statement that nobody has any business attacking thousands of innocent children and creating all kinds of additional issues. It's hard enough when you are the parent of a child with some kind of illness or special need that you cannot handle at the normal primary care pediatrician. That's why we're at Lurie. And that they would interfere with our ability to take care of our children is unconscionable.
I know some of this is out of Lurie's hands, and they're doing their best to try to mitigate the situation and the impact on patient families. How would you say they're doing so far, and will you stay with the hospital system once this gets worked out?
Well, we're getting close to aging out at Lurie. We love our Lurie providers. The doctors, the nurses, the administrative assistants that we deal with are the world's best, and we love them all. We've had really good experience with all of them. I think the biggest problem right now in terms of Lurie is they have huge issues with this crisis communication system. They are not communicating with the stakeholders. They have thousands of parents who are trying to figure out, how do I manage my child's care? And they're not talking to us as much as they should be.
Yeah. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.